Hi, I'm Alexis. I'm part of Group 7A. The other members of my group are Stephen Bruno, Sydney Cheek, Steph Erickson, Elizabeth Graft, Kira Greenan, and Samantha Levine, and they'll be presenting later in this video as well. So we would like to talk to you about the concept of radical belonging in the context of COVID-19. In order to define the radical belonging, we felt that it was really important to identify the problem first. So we'd like to provide some background information on that. So institutions have deeply rooted inequalities, and especially with racism. Some of that deep-rooted racism stems from historic events, like violent detainment of First Nations children in boarding schools, or enforced prohibitions on education, segregation, unequal funding in schools and hospitals of communities, and historical bans on ethnic studies. And this has created the idea of unbelonging. The racism that has stemmed from historical events like these continues to persist, unfortunately, and that's where we are at with the unbelonging. And so to understand unbelonging, I'd like to explain that a little further. People have not just been feeling left out, but actually told that they do not belong, and that who they are is in essence wrong, and that they have no capabilities to ever belong. And more recently, efforts have been made so that people feel physically present, but socially distant, meaning that on paper, minority groups are meeting the marks for inclusion, but in reality, they feel completely left out and unrecognized. And lastly, a large contributing factor to the unbelonging is the construct of normalism and the deviance from norms instead of creating room for alternate versions of social order. This is a huge problem, and the concept of radical belonging has been created in hopes that this gap must be fixed. And the radical belonging focuses on the building of what could be. So to define radical belonging, we need to understand not just the definition of belonging, but also what do we mean by radical? So by radical, we mean not just superficially covering up racism, inequalities on paper, but also abolishing the feeling of the unbelonging, making people feel like they are actually included because they are. That's the focus of radical. And so there's three components to this. There's social belonging, which has the more traditional view that is very individualistic, Western viewpoints focusing on being yourself and feeling respected, which, if present, has actually shown to benefit people of color. However, this way of viewing social belonging still creates room for the unbelonging, and therefore it needs change. The radical view, however, focuses on relationships and collectivism that many communities of color prioritize. Additionally, another component is academic and work-related belonging. So the traditional view of academic and work is how well you perform on tests, assignments, worksheets, or whether you feel safe or welcome at school or work. And so the radical view of this addresses the humanity of people at work. Instead of predefined rules, the people create their own learning environment or way of work so that they feel included and academically successful. This addresses expectations and that are commonly misconstrued across cultures, and it allows opportunity for growth. There could be less cultural bias in the workplace by doing this. And so this idea allows us to incorporate culture into learning and utilize it as a resource that can be celebrated. And lastly, another super important component of radical belonging is the democratic belonging. So in order to do this, we would need to address racism or minority oppression, inequalities on an institutional and governmental level. There have been changes, but there's still far more to go. Additionally, making minor changes to law that show effort or offering to learn about oppression is merely a Band-Aid. And it covers up the real problem without addressing the root of it. Like I said, pretty on paper, but not good in reality. And so the radical mechanism proposes critical reflection, looking inwards and outwards, key change that can be made in schools by educating the youth on policies, government, and the outcomes of oppression, and like mental and physical health. So furthermore, changes amongst people lead to changes amongst workplaces, lead to lobbying, lead to change at the level of the government policies. Unfortunately, humans are imperfect, and getting everyone to comply to these definitions is probably impossible. However, that doesn't mean we cannot improve. And through these efforts, the radical belonging has potential to affect lives in so many ways. Especially important to us is the ways it can heal. Especially as healthcare providers, we need to focus on the radical belonging in a healthcare setting and what it can do for inequalities in health.
Next, to summarize our findings after reviewing the case and the article by Louis et al., I'm here to discuss our team's perspective on why moving towards radical belonging is so important in the healthcare field. So first of all, we felt that both after reviewing the case and the article, that there's a need to focus more on multicultural ideology, increasing acceptance and awareness of this in order to build trust and rebuild a sense of community. And we also wanted to highlight the impact that social isolation can have, both negatively impacting mental health and even having implications on physical health. An article that we also found to kind of supplement the information within the Louis et al. Article is another one that talks about the effect of interpersonal isolation in the COVID-19 era. And it kind of supports the thoughts that we already discussed by stating that chronic stress and social isolation do have very real physical implications, anything from increased incidence of cardiovascular disease, mental health issues, and even just increased mortality in general. So as a team, preventing these secondary complications is a huge reason for why we feel that radical belonging is so important to implement.
I'll talk about our recommendations to support radical belonging on 3 levels: an organizational level, a team level, and an individual level. On an organizational level, we can talk about increasing support for families and more competitive pay. Support for families can include paid sick leave, compensation for hotel stays during a COVID infection, and babysitting or childcare resources if kids have to stay home from school and the parents can't take off time for work. With new school precautions and regulations with viral infections, more kids are having to stay home from school with just symptoms of a cold where they used to be able to go into school for the day. And therefore, parents may be having to take more days off from work. In addition to increased staffing that would allow parents to take days off from work, having covered childcare or babysitting may be one way to help support families in need in this time. In addition, we can talk about competitive pay so that travel nurses do not make more than in-house and staff nurses, and that would help people not feel as undervalued when certain members of the staff with an equivalent position and role are making more than others. On a team level, we can talk about diversity, equity, and inclusion trainings that can teach workers about different identities, including how to be respectful and why it's important to be respectful, talking about things like homophobia, racism, sexism, and transphobia, among many other topics. On an individual level, we can talk about paid training opportunities for people looking to go back to school and quote unquote move up in the hospital system towards higher paying jobs. In addition, we can talk about increasing access to mental health professionals, including free care and guaranteed time during the workday for these mental health sessions, and gathering a formalized system for patient feedback and appreciation of the staff for the care that they provide, so that the staff members can feel like their work is being appreciated by the patients in a way that's a little bit more cohesive than just like patient direct feedback, which I feel like doesn't typically happen in the hospital. So maybe having a system of writing a nice note towards the physical therapist that helps the patient during their stay, or the nurses that took care of them, that can be included in the discharge paperwork as part of the steps towards being discharged. When we consider the inequitable impact of COVID-19, 3 of our main recommendations specifically target the inequities that we see. Diversity, equity, and inclusion trainings can target specifically towards one of the statements that Jessie said in the scenario that we were given. Jessie described insensitive, often racist and homophobic remarks from her coworkers. So having these professional mandatory DEI trainings for all the staff will increase the understanding of inclusive language and behaviors, which has been proven to lead to more supportive and welcoming work environments, with empathy bridge building as one of the options for DEI sessions. When we talk about support for families, often marginalized families have decreased access to safety net systems, and therefore, while having these increased support systems in place will help the organization as a whole, they'll likely have a larger impact for the staff of marginalized communities, and it'll be kind of like the curb effect, the curb cut effect. The curbs of a sidewalk, where they kind of dip down towards the street level, were intended for from the disability community, were intended for wheelchair use, but they actually have shown to have a larger impact on like unintended people, like parents with strollers, or people with luggage, or rolling grocery carts. So just because these supports can be targeted towards marginalized families, they'll often help the larger community as well. And finally, our paid training opportunities. These opportunities will help people in lower paying jobs, and therefore those often from lower socioeconomic statuses, to be able to go back to work and work towards a degree that they may not otherwise be able to afford, and potentially change the lives of their families and change their kids' future. So that is 3 things that we're considering with the inequitable impact of COVID.
Next, I will discuss our metrics of success. With achieving radical belonging being our primary goal, we turned our recommendations to support radical belonging into measurable statements. These statements include key aspects of our recommendations from the organizational, team, and individual levels. In order to measure if radical belonging has been achieved, we will ask the organization staff to fill out this 7-statement survey at the beginning of each month. We will analyze these surveys both individually and as an average of all staff members. As the surveys will be scored out of a total of 70 points, we will accept an average ranging from 60 to 70 points, or approximately 85 to 100% as achieving radical belonging. Surveys will continue to be administered monthly even after radical belonging is achieved. This will ensure the continuity of our recommendations. We can utilize the results of these surveys to not only measure the success of our radical belonging initiatives, but also to identify which specific initiatives require more improvement. I will now review the survey that will be filled out. Each component is to be scored on a scale from 1 to 10, with 10 indicating a strong agreement towards the statement. I feel that this hospital, as an organization, provides the support that my family needs. I feel that this hospital provides competitive, fair pay for my position. I feel safe sharing my opinions with my team. I feel valued within my team. I have adequate access to mental health professionals for my individual needs. Individually, I feel that my work is important to my patients, and I feel an overall sense of radical belonging within this hospital.
When I discuss the key implementation steps and roadmap for this interprofessional team, I'm specifically addressing the steps that need to be taken to achieve that ultimate goal of radical belonging and inclusion. I'm focusing on the application of diversity, equity, and inclusion, or DEI training for this team. It's clear that this team isn't working well together and they're experiencing hardships both while at work and at home. It's our job to see to it that we eradicate any problems that may have arisen due to biases or a lack of feeling of belonging. In the short term, or while we're experiencing this pandemic, I think it would be necessary for us to begin by conducting confidential surveys. They would include one survey where we're asking questions about how individuals feel in the workplace, and a second survey to get an overall idea of everyone's understanding of radical belonging and DEI. By gathering information from these surveys, we would get a better picture of what needs to be done to move towards that radical belonging. We would be able to create a focused training on areas where our interprofessional team needs improvement. Something else that would need to happen would be an audit of the office to get a better idea of what's going on behind the scenes. What do current patient outcomes look like? What does worker satisfaction look like? What measures do we currently have in place that are either helping or hurting our mission of inclusion, just to name a few? The next step that would need to be implemented would be basic DEI training. Everyone has to start somewhere. This may include things like how to identify our own personal unconscious biases, why DEI is so important, culture and diversity awareness, identifying microaggressions, and what everyone can do to promote diversity, equity, and inclusion in the workplace. When we look at what we can do in the long term to promote diversity, equity, and inclusion, we would want to continue educating about the topic of DEI as we get more information and updated information becomes available. Completing one session of DEI training is good, but it isn't necessarily enough to promote that continued awareness of inclusion. It's always a good idea to stay up on the latest research to preserve the knowledge we already have and continually expand upon it. We as a team are responsible for taking care of one another and watching out for each other and our patients' best interests. We would equip each member of our team with the tools they need to make sure they are maintaining a healthy work environment for everyone. We as a healthcare facility also want to be informed of any incident that may arise regarding a lack of proper respect or inclusion. This training would likely be included with the continued DEI trainings. And finally, none of these things can be done without the support of one another. Much research has been done, and according to nearly all research on the subject, and VP analyst for Garter CIO's research team, Christy Struckman, healthcare teams are always more successful when they achieve inclusion and a feeling of belonging. You can make a team diverse, which is a good start, but you can't make it successful without building bridges and going the necessary extra mile to actively include and respect everyone on your team. So in order to achieve this ideal team, we want everyone to take responsibility for themselves and those around them to keep up on DEI trainings, to keep in contact with one another, to create an open line of communication, regularly conduct surveys to assess how well the trainings have been received, as well as identifying what is working and what needs to be improved. Demonstrating mutual respect for one another on the team on a regular basis. This would include, for example, active listening and acknowledging how everyone is feeling and being culturally sensitive. Continually getting to know and understand one another. There's really no better way to create connections than by actively seeking out information about one another, being mindful of one another and knowing that we are all working towards the same goals. We all want the same thing, to feel included, to feel heard while at work, as well as getting the best patient outcomes we can. By implementing DEI measures, we are making an active effort towards radical belonging.
Now I'll be discussing the financial impact, cost, and finding of this case. As we stated earlier, we're going to be talking about DEI training. These costs for a company are usually around $20 per employee per month to anything to $2,500 for 1 hour lecture on combating racism, sexism, homophobia, transphobia, among other topics. Statistics on profits of companies that implement DEI training programs are that organizations with high employee engagement resulting from improved DEI can be up to 21% more profitable than comparable organizations without. DEI reduces occurrences of workplace harassment, which is a problem that costs businesses up to $7.6 million a year. The Global Diversity Practice explains how more diverse organizations led industry innovation as diverse teams make better decisions 87% of the time. We would also like to talk about how not all basic DEI training is just anti-racism training. It includes anti-sexism training, cultural sensitivity training. It also bridges building with members of the LGBT community. Financial impact, costs, and funding continued. We're going to talk about other forms of DEI training impact. So there's also awareness training, and this helps in problem solving and decision making. It also emphasizes respect and value amongst coworkers. It promotes awareness about employees' differences, uplifts demeaned and underrepresented people in the mainstream world, and eradicates the influence of prejudices. Skill-based diversity training, developing new skills for communications with a diverse workforce, reinforcing that existing skill sets, encouraging skill building methods. There's also diversity audits, which assess happenings around a particular office, manages employee attitudes towards coworkers, such as periodical reviews related to policies and procedures, and identifies any discrimination of any sort. Lastly, there's mobile training. These programs can be organized as per employees' availabilities, which allows a lot of time and flexibility for these employers and multiple accessibilities at the same time. Recordings are possible for employers unable to access the time of the schedule.
Hello, my name's Steven, and I'll be talking about sustainability and scalability as relating to our initiative. So, as a team, we decided that organization is the core of sustainability and scalability and begins with leadership. Innovation begins with a decision to change, whether it's at the first order level of a practitioner or an individual or team, second order in an organization, school, or hospital, or even third order on a systemic level, such as law or policy change. Therefore, it's placed at the center of our model. Now, I just want to recognize that not all of our ideas are feasible for each different organization. It can depend on many factors unique to each one, including resource availability, goals, and policies. For example, things that might be applicable more at an individual or team level would be our DEI trainings. Things more applicable at an organizational level would be things such as support for families, like paid sick leave, compensation for hotel stays during a COVID infection, and competitive pay, ensuring that travel staff don't make more than in-house staff. Things that could be used at an organizational or systemic level could be things that we suggested, such as the paid training opportunities and continuing education for people looking to go back to school, free access to mental health professionals and guaranteed time off during these sessions, and developing a formalized system for patient feedback and appreciation of the staff. Understanding the organizational context of change and innovation is critical in sustaining change. It influences how research is conducted, innovation implementation, and how innovations are adapted to new contexts. Leadership can also engage stakeholders to foster a culture of change and create communication channels, as well as aiding with resources, all of which contribute to participants' collaboration and sustainability of the innovation. The most effective leadership model to support these innovations would be a bottom-up approach, supported and aligned with top-down policies. To ensure each translation of our ideas results in the most accurately measured outcome, each of them should enact the three following components to our ideas. The first component is innovation. The innovation is conceptualized for an expected or desired outcome. It can be difficult to understand why an innovation is successful or unsuccessful, but to be successful, innovations need to have a clear purpose. An essential component of sustaining change is the provision of professional learning built into the innovation. From the sustainability of new practices and educational change, the scalability of the innovation can be considered. For example, our DEI trainings could be hosted online versus in person, depending on the time or resource constraints of each organization. Our second component is research. To be meaningful and effective, this research needs to be led by participants and co-constructed in collaboration with researchers so that they can draw on both bodies of expertise and knowledge. A range of research methods and approaches should be used to support longitudinal research designs and to capture the complexity of these interventions over time to be able to inform us of future sustainability. For example, our metrics of success could take various forms and functions. On a team or individual level, they could just be simple feedback forms that people can fill out and pass back. On organizational level, it could be things like formalized surveys or feedback in emails or for performance reviews, or on a systemic level, proposing mandatory feedback. The final component is new context, which is essentially scaling an innovation after the change is in practice has been sustained. It can be different. It may be a different team adapting the use of our ideas in their practice, or it could be the implementation of a whole hospital initiative. This can take place at any of the three system levels. Importantly, scaling innovation from one context must include important considerations such as fidelity to the innovation and flexibility in adaptation. And this is all rooted in organizational context, which will strongly affect the professional learning and support of the innovation. So for my next slide, I'm just going to talk quickly about our teamwork takeaways. So some things that worked well for this project, and these are all takeaways that we met with and kind of discussed as being our top ones. So things that worked well were collaboration with shared platforms, including GroupMe and Google Slides, and that we were able to quickly define roles for which sections each person would manage and the proposal of what we were responsible for. Some things that could have been improved on were scheduling conflicts that made it challenging to find times to discuss and collaborate as a team all together. We ended up just doing them individually and then piecing them all together. Some things, but a way that we could do better next time, which I think addresses this problem, would be making the project a mandatory live presentation with another group and a faculty facilitator. Although it would have taken another session, possibly, it would have made for one easier organization of our presentation. It would have been a little bit more lively. We could have had some discussion if people had questions on each section, and I believe it really would have improved participation. So thank you for your time, and I hope you enjoyed our presentation.